I have been working in cochlear implants for 20 years. We're seeing more and more patients coming in, and our program's continuing to grow. But it does create additional challenges for us in the clinic. We have difficulty finding booth time. We're not seeing patients as timely as we would like to. So we needed to make sure that we can meet their needs as well as the needs of our clinic.
I was in 4th grade when I had my first cochlear implant surgery.
She's been doing really well since she got her implants. She's taking honors classes in middle school. She's joining clubs, she's playing sports, and her confidence has improved a lot.
Well, I was 13 when my hearing began to decline. The loss wasn't that traumatic until after my late 40s. The cochlear implants, I am bilateral, and it just changed my life.
My audiologist is Dr. Presley, but I call her Regina. And she's really nice and I like her a lot.
I love Regina. I mean, she's just the light of my life. I got a little afraid when I moved that I was going to lose that relationship, but she told me about Remote Check. And she said, this is the bridge between you and I. I'm always here.
We have implemented a tool that's called Remote Check. It's part of the Nucleus Smart app, and it's one of the lineup of the services that Cochlear provides to their recipients. They complete an in-home assessment, and we're able to follow up with the patient accordingly. Remote Check allowed us to connect with our patients and reduce the time of them coming into the office.
Like if I do need to go in and see her, I'm still able to do that, but I like this more because I don't have to drive all the way out to GBMC Hospital every time I want to have a checkup. It's very convenient because I can do it on my own time.
When I am ready to take the Remote Check, I just find a very comfortable place to sit and relax. Generally, it takes about 20 minutes.
There are multiple assessments that we can do. So one is a patient questionnaire, and then we have an audiogram, which is our typical booth testing, and then a digits and noise test will tell you if there's been any change in performance. Patients can also take a picture behind the ear and that incision and the magnet site. And then we also have data logging, and you can get a very quick glance at this, so your overall compliance and how often they're using their processors. After everything has been analyzed, we would determine the action that needs to take place. Once that's completed, a report is generated that can be shared to the EMR for documentation. Hi, Michelle and Elaine, it's Regina. I got your Remote Check results and I just wanted to review them with you. The pictures look fantastic and your performance was really good.
That's great news.
Do you have any questions for me or any comments that you want to make in terms of your Remote Check experience?
No, I don't have any questions.
Well, based on this, I think we can just regroup next year and just keep up the good work.
Thank you so much.
All right, bye-bye. They know that I'm keeping a close eye on them. If something needs to be rectified in terms of equipment, I can make recommendations that we can implement. Someone who is familiar with technology, they're very excited about it. Some patients were a little apprehensive, but once they were introduced to it and they were given some guidance, now think that it's the best thing ever.
You know, I'm not a techie person at all, believe me, but after using the Remote Check on the Nucleus app, I'm now a techie grandma.
Remote Check is a wonderful way to monitor daily performance, to stay connected to patients, give them timely service without even having to come in the office. The development of Remote Check has really been a game changer in two ways. One, to empower patients and create easy access to service, as well as to have a tremendous impact on our center's viability. I'm really excited just to see other new ways we'll be able to use it in the future.
It gives me peace of mind to know that this is something that she can do by herself.
I feel like they are taking care of me and they are on top of it. If I don't have to go in, I'm going to the beach.